Hi, and welcome to the show. Rate and review at kevinmd.com/rate. Subscribe at kevinmd.com/podcast. Today in the show, we have Harvey Castro. He's a physician, healthcare consultant, and serial entrepreneur. He's the author of the book, ChatGPT in Healthcare, The Key to the New Future of Medicine. His Kevin MD article is titled Revolutionizing Medicine, How ChatGPT is Changing the Way We Think About Healthcare. Harvey, welcome to the show.
Thanks for having me. It's an honor.
So we'll get into your book and article in a little bit, but first off, just briefly share your story and journey to where you are today.
Yeah, big picture, I'm from New York City, first generation American, come from a really humble beginning, started in poverty, which actually I mentioned it because I really think it changed who I am today. And I go into it because it gave me the passion to work in healthcare and be that physician. And I went into emergency medicine. And I always like talking about that because it brings me to the next point. I love technology and I love what's going out there. And my first taste of technology and medicine really came to home when I was in the emergency room and I had a patient that was coding. And at the time, the first iPhone had just came out and the nurse got a big textbook, was going through the textbook, and then finally got to the drug and then finally got the medicine and started. And I thought, this is taking too long. I need something. So I actually created the first med, I call it IV Meds app. And it basically went through the whole algorithm and it was just 2 touches and it gave you the dose. And so that's kind of a little quick background about me.
All right. So tell me about that intersection. You are in that tech business world. You're a serial entrepreneur. So tell me, in terms of being a physician, I always ask this of physician entrepreneurs. Has that background being a physician, has that helped you or hurt you in your entrepreneurial endeavors?
I love that question. Actually, I think it's helped me a lot because I understand the limits from a physician's point of view. And then I can also look at it from the administrator's point of view and how they see medicine. And then I can look at both and see how can I make that best intersection? Because I think sometimes administrators see it without the medicine and they want to do things that we just can't, or ethically we won't. And so looking at it from the doctor's side and understanding the science and creating a new product. And that's the part that I love. So I think it's, if anything, it's helping me.
Now, for those physicians who are interested in getting that tech space, it could be a health IT startup or whatever. So what kind of advice do you have for these physicians who want to be more involved in that tech space?
Honestly, my biggest thing is it's just like education. We all worked really hard to get that MD and it took some grit for us to get through it. And it's the same thing with technology, just keeping up and learning, starting with the basics and then going up the ranks. With that said, at your hospital, I would encourage you to be the leader at your hospital because before you know it, you're the one reading, you're the one keeping up to date, and then the administration is going to be coming to you.
All right. So let's talk about your article, how ChatGPT is changing the way we think about healthcare. And for those who don't know, of course, ChatGPT, one of the highest adoptive apps that's out there. And we're going to talk about a little bit of background for those who aren't familiar and how it intersects with our lives as physicians. Now, just to get everyone on the same page, Harvey, what is ChatGPT?
That's such a hard question. And I have been asked that a million times, and each time I have a hard time answering. My best example is think of it as having a conversation with something that you're currently using. So let's just say you're using UpToDate and you're looking up a patient. ChatGPT gives you the ability to not only just ask the question, but personalize that question. So to give you a quick example would be if you have a diabetic patient and you need to understand for the patient how to give them a better advice on their glycemic index, what you could do is go into ChatGPT, say, I need a diet for this patient. It needs to be low sugar, but then you can take it to the next step. You could say, patient also has allergies to egg, doesn't like fruit, give me a diet, and it'll actually make that diet for you. And then fast forward, once it gives it to you, you can say, I need a grocery list, and it'll print it out for you. And then after that, you can say, give me the restaurants because this weekend I'm going to be in Miami and I need to follow this diet. And it'll actually tell you what restaurants have that diet. So these are the capacity that it could do more than what Google could just do a search engine.
Now, how exactly does it work in terms of getting this information, formulating responses? How does ChatGPT work?
It's amazing. The database is up to date up to the year 2021. This is the current application. I believe next month or next quarter, there's rumors that in the next edition will come. And my guess is it'll be up to date up until that date. And how does it work? Interesting enough, it does not go into the internet. You would think it's just going into the internet and it's just getting information that way. Actually, it's going through massive amounts of different databases, and it's gathering that information that you're asking it and literally combining it and putting it into a chat format so that way you can interact with it. My biggest warning with it, and I joke with this in a respectful way, it's the best salesman in the world because no matter what you ask, it will give you an answer. The difference is when you get that answer, it could be what we call a hallucination effect, where I'm an ER doctor, you can tell me anything, and if ChatGPT says something wrong, I can call it out. But I'm not a dermatologist, so if it went into something very specific into dermatology, I would look at it and say, yeah, it looks good to me, but a dermatologist would read and be like, no, this is totally incorrect. And so it's just fascinating to me how this technology is being used right now in medicine.
Now, you've already written a book on this, ChatGPT and Healthcare, the Key to the New Future of Medicine. ChatGPT only came out at the end of November. You've already written a book about it, so you clearly thought about the massive implications that ChatGPT has on healthcare. So give us a high-level overview. What are some of the high points in terms of how it's going to affect our lives as physicians?
Yeah, I think there's a difference between what we can do today and what we can do tomorrow. So, from 10,000 feet, I wanted to just introduce the subject so that physicians can start spending time and thinking about it. I feel like some of us in healthcare take a little bit of time to adjust to new technologies, and I knew that this was going to end up taking a big portion of what's called healthcare and ChatGPT. And so, how I see this done, the simplest way I see it as education. Every 72 days, medical knowledge doubles. And so being able to go into a database, ask it questions, and be able to answer those, I think is a plus. And so I'll take it to a real example. I'm meeting with different medical students, different providers, and they're saying that for medical school, they're putting in maybe a PDF of like a chapter on cardiology, and it'll summarize the chapter, give them the high points. It'll make tables for them. It'll make flashcards for them. For a practitioner, I'm actually seeing, I got a great example the other day. I met with a pediatric cardiologist. He said that he was able to diagnose this patient, and there was only 200 cases in the whole world with this. And he, for giggles, wanted to put all the symptoms that he saw of the patient in ChatGPT. He put the symptoms, the prior imaging studies, and it came out with the diagnosis. And he was shocked because he said, Harvey, this is something, and he even mentioned the disease to me. I can't remember it myself right now, but it was something so rare. And I thought, from a point of view of it's not going to replace a human, I don't think, but I think it will help supplement. And, unfortunately, doctors can't know everything. And that's why we all specialize. But then being in our specialty, it changes so much. How nice would it be to use that tool? So that's what I'm seeing a lot of right now. And then one more example on the ER side, I work close to an airport.
Mhm.
And in the airport, we were getting people from all over the world. And unfortunately, my EMR didn't have the discharge instructions for that language. And so, again, assuming I'm not putting any things that is HIPAA obviously into this, and there's 18 identifiers, I could go in, put the diagnosis, and say this is the person's language, and it would translate, and then I could hand that to the patient. And I thought, what an amazing tool that I could use for my patients.
What is it specifically about ChatGPT that just makes such an impact? Because there's just so much technology that's introduced to physicians, and it ends up making not a difference. What's special specifically about, we call this generative AI, of course. What's specific about generative AI that you think is going to make such a big impact on our lives in contrast to some of the other technological innovations?
I think it's because it can adapt, and medicine adapts so fast. And the fact that this technology can adapt faster than we can recall a lot of these subjects, I think that's one big one. I think, in my opinion, healthcare from a physician patient point of view, it's a lot about education. You have an education on a certain disease, and you're passing that education to a patient and helping them change their practice or changing their practice health wise. And so I think ChatGPT can help you as far as on the patient side and the physician. Let me give a quick example. We talked about the physician, but what about the patient? What if the patient knew they have diabetes, they're following up with you as their primary care doctor, but then they could say, what are the best questions for my doctor? And what are the follow-up questions? And then going into the physician-patient relationship, they usually only get 13 minutes as a national average with the doctor. What if that 13 minutes was so high yield that they had these questions from ChatGPT and said, hey, this is what they said. Here you go. Do you bless this? And then now you're really creating an environment. And I foresee that being in the future. I foresee websites, APIs that will go out with ChatGPT that will integrate with basically computer systems and websites. But then a patient can go ask those medical questions, and then ChatGPT will generate the answer. But then there'll be a human being, a physician, that will read it, bless it, and send it back to the patient.
That brings us to the point about accuracy, right? So a lot of physicians, or patients for that matter, if they're asking ChatGPT for, medical advice, medical information, if you give it a constellation of symptoms, it'll give back potential diagnoses. Comment about the accuracy that you're seeing with ChatGPT as it relates to health information.
Well, it's a hard one because I could only comment on things that are in my space. And I think that's a very important statement because other physicians out there may be blessing medical knowledge from ChatGPT that may not be in their space. And no disrespect to those physicians, but it may be so specialized of an answer back from ChatGPT that they may not recognize that in fact is an error. And so I'm always cautioning patients, especially patients outside the United States, because I feel like people outside the United States can self-diagnose and then go straight to a pharmacy, pick up medication, take the medication, and what if it's the wrong medication? What if it's the wrong disease? What if the allergy? I mean, there's a million things. So from an ethics point of view, I think this has got to be taken with caution. And that's why I want to educate both the physicians and patients on how to use this tool correctly, because my bigger worry is there's a negative outcome out in the world because of ChatGPT, then it's going to delay the progress and it's going to end up hurting people in the long run because we cannot use this technology.
Talk about the company behind ChatGPT. It's a startup called OpenAI. I know Microsoft has invested billions of dollars in this. In terms of all the information that we're putting in ChatGPT, privacy, HIPAA, how are they using what we're putting? Is this something that we need to be concerned about?
Of course, yes. And I tell every doctor and patient, please do not put anything as far as your personal information. And I didn't know this until recently. I didn't realize that when someone passes away, up to 50 years later, that information cannot be shared. And so please don't put anything on the ChatGPT servers. Just to give you a quick background, OpenAI originally was supposed to be open. And Elon Musk and other billionaires put money into it because their goal was to keep this independent from a private sector. Microsoft came along, invested. I believe they have about 49% ownership right now. And so now to me, it's not really open. It's more Microsoft product. And so with that said, now that from an ethical point of view, it kind of changes things because now this isn't open. Now it's endorsed by a company. Now it's going to be looked as a product and it's got to create financial gains. And so from an ethical point of view, I worry that perhaps people that don't have the funds for this technology will not be able to get it. And those that have the funds will be able to use it and will be able to do better at work or maybe eventually get better healthcare. And so from an ethical point of view, it's an interesting question to just kind of think about.
So I'm a primary care physician. I do internal medicine. I see patients 3 days a week. Do you see any application for ChatGPT in the exam room in a typical office visit with a physician?
Yes, I'm working with some companies, and what they're doing is creating an independent server. That way, it's not all that information is not going back to the main database, and they're basically creating, I call it like a mini ChatGPT server. And so, what they're wanting to do is, for example, you would see a patient, and the patient would give you different symptoms. Then two things would happen. ChatGPT can interact with the patient, can create summaries. So when the next time you see the patient, it could go back to the last 20 times and give you a one-page summary of all those visits, and then anything more that you want can do. I know you already have that, but this will be a better summary. Other applications I love is just the medical education portion. So on the discharging of these patients, you can customize. So when you discharge a patient that's 80-year-old with diabetes versus a person that's maybe 18-year-old, your therapy may be different and your advice may be different. And so because of that customization effect through ChatGPT, that is a way that it'll be used. I think fast forward, I don't personally think it's going to be ChatGPT. I think it's going to be BioGPT, and that'll be another article in the future that I'm going to write about. But I think that's what's going to be the future in healthcare.
We read about the potential threats to some jobs that ChatGPT may bring. Is there anything that physicians need to be worried about going forward in terms of ChatGPT improving to a point it may infringe on some physician responsibilities?
I love that question, and I see a lot of debate about that question. I personally do not see it taking our job away, at least in my lifetime. I see it more that those that understand this technology and are being efficient with this technology, those are the ones that are going to eventually be hired by the bigger hospital systems and are going to want those to be promoted. And those that are physicians that are resistant to change, that do not want to use these tools, I think those doctors eventually will not have a job. And in that sense, they will be replaced, but not the way we're thinking by a computer. It'll just be by another person that's using it. And I see this more as an assistant. For example, I've worked 30-hour shifts in the ER. I know at 4, 5 in the morning, I'm really exhausted. I'm doing my best to give my best care, but how nice would it be to have a peripheral brain, just like we have on our mobile devices, why not have that resource that I can say, you know what, I'm on the fence, and it's already integrated into EMR, and it's showing me, okay, the patient said chest pain 5 different times, this and that. Here's your differential diagnosis. And I look at it, I'm like, actually, there is one on the list here that I haven't really ruled out. Let me order this following test. Or, I was on the fence. I wasn't going to order this, but the computer is really saying there's a 90% predictive value that this is probably the diagnosis and I may be missing it. Let me order these tests, or let me actually double check. I think that's how it's going to end up being used.
We're talking to Harvey Castro. He's a physician, healthcare consultant, and serial entrepreneur. His book is titled ChatGPT in Healthcare, The Key to the New Future of Medicine. We're talking about his Kevin MD article, Revolutionizing Medicine, How ChatGPT is Changing the Way We Think About Healthcare. Harvey, I know that there's been some seismic changes. ChatGPT has only been here for about 3 to 4 months now. What do you see the next, normally I say 1 year to bring. Generative AI is moving so quickly. What's the next few months going to bring?
Honestly, there's lots of rumors. Now they're going to add images to ChatGPT. And when that happens, again, this is rumors. I believe it's going to revolutionize medicine, especially dermatology. And let me give you a quick example. If you could put symptoms and a picture of a mole or picture of a pathology, and ChatGPT is able to look at those factors and turn around and say, it's possibly this, then I know that already exists out there in some companies, but I think this is going to change that. And then fast forward, if I can show a picture of you to ChatGPT and it turns around and says, okay, here's his website, here's everything. Those are the things that are coming. And imagine all the medical applications that can come from that. And that's what ChatGPT 4. And I really think that's going to happen this year.
And my final question, tell us some of your take-home messages you want to leave with the Kevin MD audience.
Honestly, at the end of the day, I just want everybody just to keep up with technology. I know some of us are resistant to change, but just learn about it. And my take-home message is there's nothing wrong with just reading about it and learning about it. And so that's basically it. Stay up to date.
Harvey, thank you so much for sharing your time and insight, and thanks again for being on the show.